Does anyone you know possibly have fibroids? Manage and understand the symptoms. See a system which is working for millions. Go to freeoffibroids.com and learn everything about uterine fibroids.
They're huge. They're huge. And I've been told that I have to have a hysterectomy, and I just don't feel ready for a hysterectomy. So I am wondering what my alternatives are.
As a gynecologist, this is what I do all the time. And we used to only have hysterectomies to treat fibroids, because the problem with uterine fibroids, which are small, well, they can get large, and that's when you want to start to treat them. But usually, because they're very, very common, but they're benign growths on the uterus. So they're not cancerous, that's the good thing, and they don't usually lead to cancer. But they're very common. 3 out of 4 women will have fibroids. Now that we do more ultrasounds, we'll find little fibroids and things like that. If you want to have babies, sometimes it can cause preterm labor, so it can cause problems for fertility as well. But really the indications to have them removed are if they're so large that they're going to start to compress on things like your bladder or the tubes that lead to your kidneys, the ureters.
How big do these get? Like golf ball size?
Oh,
or baseball size?
I've taken out like a turkey size, like a 20-week.
They can be one of some of the largest tumors that can grow in the body.
Absolutely. They just, kind of grow wild, but they're usually slower growing. And now we have lots of different options. So really the reasons you want to have it taken out are if it's huge, or if you're having heavy bleeding that's causing severe anemia, or that it's affecting your lifestyle so much if you're just bleeding all the time. And now with all the options, there's different invasive and non-invasive options for myomectomies. That's removal of the fibroids in the uterus, instead of a hysterectomy, which is just removing the uterus. So for myomectomies, you can either have it taken out invasive, you use an incision on the abdomen, lower incision like a C-section, then you make an incision on the fibroid, you dissect out the fibroid, and then you just close up that incision. You use some medication to keep it from bleeding, and it goes away. Now, a less invasive procedure is laparoscopy. And you inflate the abdomen with CO2, use these special ports to put instruments in, you make an incision again on the fibroid, you shell it out, and it'll just heal by itself. You don't actually have to repair it. And then you just have those 3 tiny little scars. Now, the reasons that sometimes you can't have certain procedures are they might not be good for having kids afterwards. There's another thing called uterine artery embolization, and that's where they put little materials into the arteries that supply the uterus, and these keep the blood flow to the fibroids from coming, and that causes the fibroids to shrink. So an interventional radiologist will do this, not a gynecologist like myself, but they'll inject these materials into those vessels, and that will shrink the fibroids. And that's really, really a very non-invasive approach to it. Problem with that is it's not very good for someone who wants to have future pregnancies. So there's a lot of different options now. There's also medications. There's also hysteroscopic ways where you can go in vaginally and sort of scoop the fibroids out, but not if they're large. So there's lots of options now for women with fibroids.
Will they grow back if you remove them once? Can they grow back?
They can. If you're just removing the fibroid, they can grow back. That's why hysterectomy will solve your problems. But not every woman wants her uterus taken out.
Right.
But there are options. Thank you for your question, and good luck.
Thank you. Thank you.
Go to freeoffibroids.com.